Good day everyone, I am Hyacinth C. Pedro from BSN 2A and today I will be discussing about breech presentation. To begin, let's first define what breech presentation is. Breech presentation refers to a fetal position in which the buttocks or the feet are positioned to deliver first instead of the head. Normally, by the third semester, the fetus assumes a head-down or cephalic presentation, but in about 3 to 4% of term pregnancies, the fetus remains in breech. There are three main types of breech presentations: the front breech, complete breech, and footling breech. First is the front breech. This is when the hips are flexed and knees extended, so the buttocks present first. Next is the complete breech. This is when both hips and knees are flexed, buttocks and feet present together. And next is the footling breech. This is when one or both feet present first, which is more common in preterm deliveries. Each type has different implications for delivery and requires specific nursing interventions. Next is the causes and risk factors. There are several factors which contribute to breech presentation, including prematurity, uterine anomalies, multiple gestation, polyhydramnios or oligohydramnios, placenta previa, and fetal abnormalities. As nurses, it's crucial to recognize these risk factors during prenatal care. Breech presentation is usually diagnosed through abdominal palpation using Leopold's maneuver, vaginal examination during labor, and ultrasound, which provides confirmation and helps determine the type of breech and fetal well-being. Nurses play a key role in assisting with these assessments and monitoring maternal and fetal signs. Next is the management options. There are two main management options. First is the external cephalic version, and second is depending on the mode of delivery, which can either be vaginal breech delivery or cesarean section. Let us first talk about the external cephalic version or ECV. It is a manual procedure done around 36 to 37 weeks to turn the fetus to a head-down position. Nurses support the procedure by monitoring fetal heart rate and providing patient education. Next is the mode of delivery, which can either be vaginal breech delivery or cesarean section. Vaginal breech delivery is possible only in select cases with experienced providers, and cesarean section is often preferred to reduce risks, especially in primigravida or footling breech. These are the possible complications of breech presentation, including umbilical cord prolapse, birth trauma or head entrapment, fetal hypoxia, and cesarean delivery complications. Prompt recognition and teamwork between nurses and physicians are essential to manage these risks. To wrap up, breech presentation happens when a baby is positioned feet or bottom first instead of head down. It's not very common, only about 3 to 4% of full-term pregnancies, but when it happens, it needs careful attention. There are different types like frank, complete, and footling breech, and they can be caused by things like prematurity, too much or too little amniotic fluid, or the shape of the uterus. We usually find out through physical exams and ultrasound. Management can include trying to turn the baby through a procedure called external cephalic version or planning for a C-section if needed. As nurses, we play a really important role, not just in monitoring the mother and the baby, but also in giving support, answering questions, and making sure everything is ready for a safe delivery. In the end, it's all about working as a team to keep both mom and baby safe and healthy. Again, I am Mary Hyacinth C. Pedro from BSN 2A, and thank you for watching.